Good day to all and welcome to NGP's Expert Talk series on World Alzheimer's Day. Today, we are honored to be joined by a distinguished neurologist who has dedicated his career to unravel the complexities on Alzheimer's disease. For the benefit of audience, I would now like to introduce Dr. Senthil Kumar E, a highly accomplished and dedicated medical professional who is a renowned specialist in the field of neurology. With an impressive academic background and extensive experience, Dr. Senthil Kumar has made significant contributions to the medical community, particularly in the areas of pediatric neurology and electroencephalography. Dr. Senthil Kumar presented a compelling case report on osteopetrosis manifesting as a recurrent bifacial palsy in childhood. This research not only showcases his expertise but also highlights his commitment to improving the understanding and treatment of rare neurological conditions. Doctor currently serves as a consultant neurologist at Kumar Medical Center and Hospital, Coimbatore. His dedication to patient care, commitment to research, and recognition within the medical community make him a valuable asset to the field of neurology and a trusted healthcare professional for patients seeking a neurological expertise. Join us as we explore the latest developments in diagnosis, treatment, and the vital role of research shaping our understanding on this condition. Stay tuned till the end of this conversation that sheds light for the path forward to fight against the disease Alzheimer's. Good day, Doctor. Glad to interact with you on World Alzheimer's Day. Kindly tell us what this Alzheimer's disease is all about.
I am Dr. Senthil Kumar, working as a consultant neurologist in KMCH Coimbatore. And first of all, I would like to thank for inviting me as a speaker in this interview. And the topic, as Ms. Shindhuja already told, it is Alzheimer's disease. And before moving on to Alzheimer's disease, we all should know what is dementia. So dementia is a term which was coined to encompass a lot of neurological symptoms, and among them common things are memory difficulty, learning difficulty, and difficulty to think, difficulty to judge, and disorientation, and forgetting close ones, and forgetting how to do the activities of daily living like cooking and bathing, all those things. So if the disability involves more than one domain, that is the term we use dementia. And this dementia has got lot of reasons and lot of causes. And among them, the most common is the Alzheimer's disease. So Alzheimer's disease is one of the most common cause for dementia. And this Alzheimer's usually happens in people more than 65 years of age. Anything which happens below 65 years of age, that we call as young onset dementia. So the most common cause for late onset dementia after the age of 65 is Alzheimer's dementia.
Thank you, Doctor. That was a really great piece of information. So my first question to you is, Doctor, while I was preparing for this interview, I read that this Alzheimer's disease is a rare phenomenon for children. So in order to understand it better, is this Alzheimer's disease really a concern to teenagers? Or are there any specific cases or circumstances where it might even occur at such a young age?
As I already mentioned, Alzheimer's disease happens usually after the age of 65, and it can also happen in individuals less than 65, but it is a rare occurrence. It is called young onset Alzheimer's disease. So if the age of onset at the time of diagnosis is less than 65, it is called young onset Alzheimer's. Usually the young onset Alzheimer's happens at the age between 30 to 65. Recently, almost some 3-4 months back, in China, they have reported youngest case of Alzheimer's in a 19-year-old male, I think. This is the youngest person reported to be suffering from Alzheimer's disease across the globe. And before that, I think 2 years before there was a case, and the age was around 23, 24. So these are all very rare phenomena to happen. The most common age to develop Alzheimer's disease is after 65. 5 to 6% can develop between the ages of 30 to 65, and it is very, very extremely rare phenomena to happen before the age of 35. So people under 35, they are no need to have a great concern whether they will develop Alzheimer's disease. And there are various other reasons to develop Alzheimer's dementia in younger population if they are especially less than 65. We generally consider other causes of dementia rather than Alzheimer's disease if the age of the person is less than 65. But if it is one syndrome is there called Down syndrome. I think you all would have heard about it, because one of the common genetic syndrome happens because of mutation in chromosome 21, and in that Down syndrome, these people are more risk of developing Alzheimer's disease. If a person is developing Alzheimer's at a very young age, what the literature says is there is a genetic predisposition to him or her to develop Alzheimer's at a very young age. For that person, we should screen for any genetics, especially the family members.
Thank you, doctor. That was really informative. My next question is, doctor, what role does genetic play during the early onset of this Alzheimer's disease? Are there any specific genetic markers or risk factors that parents should be aware of?
If a person develops symptoms suggestive of Alzheimer's disease before the age of 65, genetic markers, genetic mutations plays a very important role. There are so many genes reported, but the three are commonly reported early onset Alzheimer's. Among them are the APP gene, that is amyloid precursor protein, and presenilin 1 and presenilin 2. These three genes are associated with the early onset of Alzheimer's disease. And we can screen for these genomic sequences, these abnormal genes, and then we can confirm the diagnosis. Why it is so important means, so once you diagnose, we can screen the other family members if they are willing to undergo the screening test. What do we do if the test comes positive and the patient is pre-symptomatic? The science is growing. There are so many newer treatment targets coming, and we can use them in the pre-symptomatic and early symptomatic so that we can prevent them from the development of full-blown Alzheimer's disease. The second part of the question, what the parents should be concerned about the risk factors and all. The risk factors for Alzheimer's are many, and it starts from the childhood. So good education, learning more languages. These two are very important in the childhood because it stimulates more neuronal synapses. So that more synapses, lesser the cognitive decline when they grow. So number one. And two is hearing. And if the hearing is less, so basically the communication will become less. And once the communication is less, the brain stimulation will be less. So again, the lesser the synapse, the more the chance of developing a neuronal decline, cognitive decline when they age. And three, the parents should make the children very playful. These days, playing, I think, not happening in a very rampant way. People are most of the time inside the house, looking at the phone, looking at the TV, and looking in front of the computer and searching something, and not going outside, and no physical play is not happening. Most of the time there will be sedentary play. This will result in a syndrome called obesity, and obesity is linked to the development of Alzheimer's disease at the later stages. So parents should educate, they should compel the children to play, and every day they should spend some time in playing, and they should alarm the child whenever the child is putting on weight. Any children's, if their family members are suffering from dementia, if their children develops any new onset behavioral problems, and they should take the children immediately to a doctor rather than thinking themselves, no, this is common in this age and I should not take this as a serious thing, and why should I take him to doctor? If the other person, a nearby person knows, that will become a stigma, all those things.
Thank you for that one, doctor. My third question to you is, doctor, I read that this Alzheimer's disease affects the person's ability to function normally. So, in order to prevent it at an earlier stage, what are the early signs and symptoms associated with this disease in adults, and how can people differentiate it from the age-related cognitive changes?
Common symptoms of Alzheimer's disease, like any other dementia, loss of memory is the first thing to start in Alzheimer's. So this loss of memory is for the recent memory. There are three types of memory. One is immediate, recent, and remote memories. And in Alzheimer's, the recent memories are the first to get affected. And second thing is where the disease starts and where the disease progresses in the brain. So Alzheimer's starts in the temporal lobes. So memory is the thing which will get first affected in Alzheimer's. And then it spreads posteriorly to the parietal lobes. Once it spreads posteriorly, they will lose the praxis. Praxis is the loss of learned functions like cooking, dressing, bathing, brushing, like any other thing, whatever they learned during their aging process. They will tend to lose the ability, they lose the ability of all those things. And spatial disorientation, they will forget their ways. And if it spreads anteriorly, if it is involving the frontal lobes, and then there comes, they lose the judgment. And then they'll be having difficulty in planning, they'll be having difficulty in organizing, and they will be socially withdrawn. Like they'll be sitting in a place, and then their regular routines will be changed, and they will not be communicating with the family members, and they will lose their interest in discussing about their family matters. And sometimes the behavioral changes comes, like a person who was very sober become like very angry, arrogant, and a person who was very angry, arrogant, and irritable, restless most of the times will become sober. And so these behavioral changes will be very prominent, and suddenly they start eating more, like they eat, and then they vomit. They do not know when to stop, and the craving for food happens, craving for sweet happens, and their personality changes, their behavioral changes, all those things. And then when it goes more posteriorly involving the occipital lobe, people tend to forget their faces. They tend to forget even the close relatives, and finally a stage comes, they forget even their own family members, and they forget about themselves, and they'll be like a person without anything, a living vegetable basically, and moving vegetable without any emotions and anything linked to him or her. So how Alzheimer's is different from other dementias, there are other common dementias like frontotemporal dementias, vascular dementias, and other things. But in Alzheimer's, to start with, it is the loss of recent memory, and it is the first thing noticed by the family members. Most of the time, it is the family member who brings the patient to the hospital. Very rarely a patient himself comes to the hospital with the symptoms saying, "Doctor, I am losing memory." And particularly if a person comes after the age of 65, and Alzheimer's becomes a very common diagnosis. And Alzheimer's is not senile dementia. You have to understand, senile dementia starts at the age of 80, 85. Alzheimer's starts at the age of 65. So any person who is losing memory at the age of 65 definitely is not senile dementia, and you should investigate, because that person might be benefited from the existing treatment options.
Thank you for that one, Doctor. Doctor, is there any notable difference between Alzheimer's disease present in adults compared with other neurodegenerative disorders?
Yeah, there are differences, like all the neurodegenerative disorders in the brain. If you take this dementia, as I told, at one point there is this Alzheimer's disease, and then the second common was the frontotemporal, third is the vascular dementia, and then other things, the normal pressure hydrocephalus. So if I take this frontotemporal dementia, the frontal things will be more dominant. The frontal is the thing which is more important for our personality, behavior, social interaction, judgment, orientation, and communication skills, and the immediate memory, and who are you, and how you present yourself, and how others see. Everything is managed by the frontal lobe. So in frontotemporal dementia, it is the frontal lobe symptoms which will be more dominant. Like in Alzheimer's, it is a memory which is more dominant symptom. And if you take a condition called normal pressure hydrocephalus, that is a condition that also can cause dementia because of accumulation of CSF in the brain. In that, walking difficulty is the most common condition. That person also will have dementia. There is other condition called Lewy body dementia. In Lewy body dementia, people have dementia, but psychosis will be more dominant. Psychosis is like the person behaving very erratically and do not have insight into what the person is doing. So psychosis, there is no insight into it. And so psychosis will be more dominant symptom in that. The vascular dementia will be there, and again the problem with the gait, and problem in controlling urine, problem in controlling our stools, and the problem in controlling our emotions will be more prominent than the dementia, that like loss of memory. So ultimately, as I already told, dementia is a very broad term under which there are so many symptoms will be there. More than one domain, if it is affected, that definition qualifies for dementia. Among the dementia, Alzheimer's stands first, and in the Alzheimer's, the most common symptom is loss of recent memory. Like for example, நான் இவங்ககிட்ட சொல்கிறேன் லைக் நாளைக்கு நம்ம இந்த வீட்டுக்கு போகணும் லைக் இந்த ஃபங்க்ஷன் இருக்குது அண்ட் இவங்களாம் வருவாங்க அண்ட் வி ஹேவ் டு சே திஸ் அண்ட் வி ஹேவ் டு டூ திஸ் ஆஃப்டர் 10 minutes தட் பர்சன் வில் பி ஆஸ்கிங் லைக் நாளைக்கு எங்கே போகிறோம் நம்ம லைக் வேர் ஆர் வி கோயிங் நாளைக்கு என்ன பண்ண போகிறோம் வாட் இஸ் அ ரெகுலர் டேட் டுமாரோ நம்மளோட ஸ்கெடியூல் என்ன அகெயின் ஹி வில் ஃபர்கெட் எவ்ரி திங் அண்ட் தென் த பர்சன் வில் பி கீப் ஆன் ரிப்பீட்டிங் இட் and this will like go for like 10-15 times, but still that next day that person will not have any memory of this conversation. And another example is that person might have kept the car keys here somewhere in the room, and then like he would have totally lost memory about where he had kept, and he will be searching the whole house where he had kept, and he will be like questioning every person, have you seen like this will become a common day-to-day routine in his life. This thing can happen in any people, any person's age, but any person's life, but this will happen regularly in that person's life. So this loss of recent memory is so disturbing, not only for the patient but also for the caregiver.
Thank you for your detailed description, doctor. This being a digital era, I would now ask you a question relating Alzheimer's disease with technology. So what are the various research developments that helps in understanding the causes as well as the mechanisms of this disease? And also, what are the recent breakthroughs that offer full potential to, recognize this disease at an earlier stage?
For diagnosing dementia, we have set guidelines, and the person has to fulfill all the written criteria to diagnose the dementia. And then for Alzheimer's, there is a set of criteria. So first, the person has to fulfill the clinical criteria for probable or possible Alzheimer's disease, and then we move on to MRI brain and magnetic resonance imaging of brain with the 1.5 or 3 Tesla. And what it shows is, I already told, Alzheimer's starts in the temporal lobe. Temporal lobe atrophy will be more prominent in the MRI. So if it is patient is come to you in an early stage where the temporal lobe atrophy is not seen in the MRI, and then we move on to a imaging called PET, PET. That is positron emission CT computer tomography. There we measure the metabolism of brain. What metabolism? Glucose metabolism, because brain depends only on glucose. It don't use any other thing to use energy. Like it depends only on glucose. So glucose metabolism in the brain with the help of FDG, that fluorodeoxyglucose, 18-fluorodeoxyglucose, and then we see where are the portions of the brain the metabolism is less and where it is normal. And usually in Alzheimer's we have some 4-5 areas like temporal lobe, and then posterior parietal, and then precuneus. There are like 3-4 areas of the brain. They are very synchronous. Like if I see your face, I will tell you your name. If I see your face, I will tell you. Like that, in PET, you see the signature. This is a very signature of Alzheimer's dementia. Another technology is like pathophysiology of Alzheimer's is a deposition of abnormal protein called amyloid. This amyloid gets deposited outside the cells, and then there is a protein called tau that gets hyperphosphorylated, and it results in the formation of neurofibrillary tangles. So these are the two words which are more important in pathophysiology of amyloid. One is this Alzheimer's, one is beta amyloid, the second is neurofibrillary tangles. This beta amyloid gets deposited outside the cell, this NFT gets deposited inside, both of which results in death of the cell. Ultimately, loss of the neurons, loss of the connections, loss of connections leads to cumulative loss of cognitive disability. So now what can we do is, we do a imaging called amyloid imaging. In amyloid imaging, it enlightens the portion of the brain where this amyloid is deposited. So depending upon the burden, we can tell whether it is amyloid or whether it is any other disease which results in abnormal deposition of beta amyloid. And we do a procedure called lumbar puncture, and we do it in the spine. And then why do we do the lumbar puncture? We remove a fluid called cerebrospinal fluid. We all know it is circulating within your brain, and then in the fluid we see for a biomarker this beta amyloid. And if the levels of beta amyloid is elevated as compared to the serum, that also gives the diagnosis that person is suffering from Alzheimer's disease. There are like clinical examination, MRI, PET-CT, amyloid scan, and CSF biomarker. All these things which helps in the diagnosis of Alzheimer's disease.
Thank you, doctor. That was really an eye-opener. My next question is, doctor, what role does these lifestyle factors, like diet, exercise, as well as cognitive engagement, helps in reducing the risk of this Alzheimer's disease?
Yeah, definitely it plays. I think these are the only thing I think everybody should know to prevent as well as to reduce the progression of Alzheimer's disease. There are modifiable and non-modifiable risk factors if you take any disease. And non-modifiable, we all know age. So if you age, the risk of you developing dementia is high. Second non-modifiable is your gene makeup. If you are carrying a abnormal gene like ApoE, APP, presenilin 1, presenilin 2, you are more likely to develop this Alzheimer's disease. I am not saying any person who carries this abnormal gene will develop Alzheimer's. I am not saying all Alzheimer's will have this genetic mutation. I am telling if you are carrying this abnormal gene, your risk of developing Alzheimer's disease is high. This is what literature says. Till now, nobody is able to pinpoint only one statement that if you have this, you develop Alzheimer's. So all are like risk factors. So coming to the modifiable risk factors. Among the modifiable risk factors, the first thing comes is your, as of now, most rampant medical condition in India is hypertension and diabetes. People takes it very regularly, and these two things are risk factors for any diseases if you name it. Control the hypertension, control the diabetes with your family physician will help to reduce the development of Alzheimer's disease once you age. Number one. 2. Smoking and alcohol. So smoking is again linked to the increased risk of Alzheimer's, and alcohol, I don't know like this social drinking term. Social drinking differs for different people. The quantity of using alcohol in social drinking also differs for different people. Finally, the social drinking can lead to some other diseases. That time only we will come to know that is not a social drinking. Maybe probably I am a regular drinker. Alcoholism is linked to the development of Alzheimer's at the later stages. As I already told, obesity. Obesity has been linked to increased risk of Alzheimer's once you age. As I already mentioned, a good schooling at your early ages and learning multiple languages is generally useful. And caffeine has been linked to some prevention in development of Alzheimer's, particularly if you use it in your midlife, 3 to 4 coffees a day, and if you can tolerate. But again, caffeine can result in anxiety, and more coffee, sometimes you may develop sleep disturbance. So every person's tolerability to coffee is different, but it's been said that moderate intake of coffee is somehow proven to be helpful at later stages of you developing Alzheimer's disease. Your cardiovascular disease like heart problems, heart and head connection. Like if your heart is weak, your head also will become weak. Like this is one common term. Why means that if your heart pumping is less, the blood flow to the brain becomes less. So the cells will deprive the oxygen. So the neurons will start to die and the connections will become less. So your chance of getting Alzheimer's at a later stage is high. Again, high cholesterol. If your cholesterol levels are high and you developing the chance of Alzheimer's disease is high, so how are you going to reduce the cholesterol? Good healthy lifestyle and good eating habits. Most important is, again I already told, physical act. At least 150 minutes of physical activity in a week is essential to prevent many medical conditions. Among them, one of them is Alzheimer's disease. So there are many modifiable risk factors, but these things we have to follow from childhood and not at 60. And once you retire, you will have time, so that time I will follow all those things. That will never help. So I think if you start from your early childhood, probably our chance of getting Alzheimer's will be definitely less. This is what I would suggest.
Thank you, doctor. I didn't know that these lifestyle factors would play a major role. My one last question to you is, doctor, care is something that is needed for health. So how can family members and caregivers best support someone who is diagnosed with this disease? And also, what are the various resources and strategies available for maintaining both medical as well as emotional aspect of this condition?
We are a developing nation and our support system is actually weak. Basically, what we do is once we diagnose Alzheimer's, so we have a good discussion with the family members, particularly the person is a husband, so we call the wife and then we call the children's. We'll have a discussion with them, see that person is suffering from this disease and this diagnosis is a progressive condition. He is not going to be the same. Slowly he may lose whatever he has acquired all these years. He might behave like a child as the year passes. So don't get angry upon him or her. Try to understand. There are so many websites available to learn about what is this condition, how this happens, and lot of support groups and lot of other families, and they share their opinion and how to do and what to do, what are the diet and what are the new things, so that if you are enrolled in that site, probably you will be getting more information about the newer treatment options. We do not have a great support system from the government side, like you go and register and then caregiver will be sent to your home and they will be taking care of you and you will be getting some any monetary benefit from the government. Those things are still not happening in a great way. Ultimately, it is the caregiver who is going to suffer, not the patient, because the patient is slowly going to lose the insight into the problem and the caregiver burden increases. Patient support will gradually come down within the family and the stigma again increases. He will not be able to take him outside if the person is very violent and aggressive, all those things, and they will be facing a lot of stigmas. First thing is education to the caregivers. Second thing is emotional support to the caregivers. Third thing is social support to the caregivers. Fourth thing is once the person enters into the later stages of dementia, possibly we can have a video consultation. No need to bring the patient because it is very difficult for them to bring him here. And we can help them anything we can do from here. The research which is happening in Alzheimer's is going on for almost 30 years. Researchers have come up with newer treatment options, basically targeting the beta amyloid and neurofibrillary tangles. As of now, the US FDA has approved two drugs. They are monoclonal antibodies against the beta amyloid. So giving this drug will remove the beta amyloid from the brain so that your brain further damage will reduce. This drug is so costly. I don't think even an upper middle class person will afford this. So again, our support from the insurance or our support from the from the government for this drug is as of now definitely not there. We all hoping that maybe we can get this drug at a lesser cost. Some support groups will help people to get this drug in future, so that our patients, like the Western population, also will benefit from the targeted therapy.
Thank you, doctor. Thank you very much for all your valuable answers. It's an indeed absolute delight interacting with you today. And I hope the viewers would have learned a lot about this Alzheimer's disease as much as I did. Thank you very much, doctor.